Good morning. Am I audible? Good morning, all. Am I audible? Good morning, all. We are starting our reading club.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for this wonderful divine science and his gift to all of us. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sir, who have bridged this divine science with the modern science and made homeopathy be like mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijayakaraaya Namah. So friends, we are in the journey of learning the wisdom of Dr. Samuel Hahnemann, the Organon of Medicine, the 6th editions. Along with we are reading the books Genetic Materia Medica by Dr. Prafull Vijayakar. In Organon journey, we have a practical aspect of applications of the homeopathic materia medica or homeopathic medicinal knowledge, pathogenic power to the applications of the disease. In continuation of which, we are continuing the aphorism number 169. Before aphorism, we have seen that the law of similia has to be applied, and you use that the remedy to be prescribed on the basis of the symptom similarity, which is of peculiar, pure, rare, SSPUS, which we have learned in striking, singular, peculiar, uncommon remedies. But when we have applying a certain remedy which is based on the partial minimum, and sometimes we find that that remedy produces some symptoms, so do not worry about that, and you have to select the best homeopathic medicines out of the symptoms which you have, and then you apply. So you get the result. So in further continuation of this aphorisms, if on the first examinations of the disease and the first selections of the medicine, we should find that the totality of the symptoms of the disease would not be effectually covered by the disease ailment of the single medicine, owing to the insufficient number of the known remedy, but that two medicines contend for the preference in the point of appropriateness, one of which is more homeopathically suitable for one part and the other for the another part of the symptoms of the disease. अभी क्या होता है जब हम मेडिसिन सिलेक्ट करते हैं तो जब हमारे पास केस आता है तो वी हैव टू सी दैट वी हैव टू रेमेडीज इन अवर हैंड ये भी कॉन्स्टिट्यूशनल लग रहा है ये भी कॉन्स्टिट्यूशनल लग रहा है तो व्हाट शुड वी डू so what Master Haneman advised that it is not advisable after employment of the more suitable of the two medicines to administer the other without a fresh examination and much less to give both together. So जब दो मेडिसिन साथ में आती है तो do not apply two medicine same time. One criteria. Second, one medicine we have applied and after that it is not effective, then we have to apply another medicine which we have thought previously. It is also not to do like this. Before doing anything, you need to take a fresh case again and then you have to apply. So it is not advisable after the employment of the more suitable of the two medicines to administer the other without the fresh examinations and much less to give both together. For medicine that seems to be the next best would not under the change of circumstances that has in the meantime taken place be suitable for the rest of the symptoms that then remain, in which case consequently, a more appropriate homeopathic remedy must be selected in the place of the second medicine for the set of symptoms as they appear on a new inspection. So this is what very important aspect of every time you have to take a fresh case if your medicine is not working in a proper way. And then you have to apply a new medicine. So aphorism number 170 says, hence in this, as in other cases where a change of the morbid state has occurred, the remaining set of the symptoms now present must be inquired into. And without paying any attention to the medicine which at first appeared to be the next in the point of suitableness, another homeopathic medicines as appropriate as possible to the new state now before us must be selected. So this is what Master Hanuman's wisdom is, that we have pre-bias and conceived idea that we have selected one medicine and we have given a medicine, but if it is not so, many a time we put our analysis and we write that tentative medicine. That tentative medicine is not like that. So do not keep that in your mind. Before that, the morbid state you have to select, and then the morbid state you do not give importance to the previous medicines that were selected on the basis of certain symptom similarity. But the new symptoms you have found, the new state you have found, you have to apply that new state and then select the remedy. If it should happen, as is not often the case, that the medicine which at first appear to be the next best seems still be well adapted for the morbid state that remain, so much the more will it merit our confidence and deserve to be employed in the preference to the other. So this is what very important wisdom Master Hahnemann is telling us. And Why he is telling this? Because he has many experience that he is applying his knowledge of medicines to the patients and he found certain phenomena. So in further aphorisms, when you have a few number of symptoms or a less number of the symptoms, then what to do? So this is what Master Hahnemann says, that there is a straight way, you go to this way, and sometimes there is a zigzag way, so you go to the zigzag way also to the reach to the target goal as a destination of cure. So this is what Master Hahnemann has advised us with this aphorism. So in non-venereal disease, that means the disease which is arising from the sora, most commonly therefore arising from the sora, we often require, in order to effect a cure, to give a several antisoric remedies in succession. So sometimes it is what Master Hahnemann says, that it is not hard and fast rule that only one remedy cure a patient for a lifetime. So whenever the patient comes to us with a certain symptomatology, like say for physiological symptoms, so in physiological symptoms you require another remedy. Whenever the patient having a chronic state, you require the another remedy. So that is what you have to keep in the mind, that the one person cannot be treated with the single remedy, and that is what Master Hahnemann is telling us. So you, in order to cure or effect the cure, to give us several antisoric remedy in successions, and the every successive one, that is the path of zigzag path of cure. Every successive one being homeopathically chosen in the consonance with the group of symptoms remaining after the completion of the actions of the previous remedy, which may have been employed in the single dose or in the several successive doses. So this is what you have to keep in the mind, that the one person cannot get cured with only single remedy, but you need to have a different path of a zigzag way of cure. So in that case, you require a several episodic remedy. So many a time in a clinical practice, we have experienced that we have applied a certain number of remedy in one case, and sometime one remedy has been curing, and the patient again comes with another relapse symptoms or another symptom, then we apply another remedy, then also curing is a law of cure, then also the symptoms arises. So in that case, you require a different several antisoric remedy in successions to get the results. And we are reading the Genetic Materia Medica by Dr. Prafull Vijayakar, sir. So in continuation of this, up till now in this book, we have covered the Baraita group and the understanding of the salt of the Baraitas and the different applications, and followed by we have learned the understanding and the reading of Calcarea group, the beautiful story of the chalk. The chalk is giving the autobiography of himself, and that is what the Calcarea presentation is. And followed by we have started with the salt of the Calcarea. So in continuation of this, we are reading further the another salt. So yesterday, day before yesterday, we have completed the first salt is Calcarea phos. The second salt we are reading today is the Calcarea Rs. So as you all know, the Calcarea Rs is the combinations of the Calcarea and the arsenic. So how you find the Calcarea? So this is what we know, the resume of the Calcarea. So we revise that resume again, that how the Calcarea present to us. So Calcarea resume is like this. The anticipatory anxiety, anxious, timid, insecure, fearful, and anger and exclusiveness in the psychosis. They can be tall, can be fatty, bony, chilly, thirsty, desire for cold and sweets. They are more insecure and need cover protections from the social, family, money, spiritualistic, and godly protections. They are sensitive to many things, like sensitive to criticism, rudeness, scolding, admonitions, horrible things, sad stories, and sad movies. So this is what the resume of Calcarea, and to combine this resume with the arsenic aspect, so that we have the Calcarea R in our learning. So Calcarea R chili calcarea with the fastidiousness. The component of the fastidiousness is the key hallmark of the arsenic, anxiety, and the gastric problem. Again, both Calcarea is more anxious and apprehensive, same arsenic also become more apprehensive and anticipatory. So this is what the combination gives rise to more anxiety and the gastric trouble. So it is the Calcarea with the anxiety of arsenic that makes it more meticulous and fastidious. The only thing that differentiates it from other calcarea is the patient's desire warm soup and warm food as against cold food and cold drinks of the calcarea. Very important aspect of whenever you are thinking of the warm food and warm drinks desire, you need to remember, always we have remember the what we call as calcarea. Lycopodium is one of the remedy desire for the warm foods. But here in this we have to remember that the Calcarea are also desire for the warm foods and warm drinks. So whenever you find out the chili remedy which requires a warm food and warm drinks desire for, you can think of arsenic and another remedy is Calcarea ars. The general aggravations of Calcarea ars is like arsenic around the midnight aggravations or 3 a.m. aggravations, especially in the fever cases. So another things mark about the Calcarea ars which can prompt us to prescribe it is the strange correlation between the gastric and the cardiac symptoms. So most of the people who have irritations with the palpitations, people who have salivations with the palpitations, people who have a liver and spleen enlargement with the palpitations. So here the palpitations is the concomitant symptoms in the calcarea ars. So whenever any emotional disturbances happen, any anxiety happen, any stresses happen, this person goes into state of palpitation. Even with the small ailment like the irritations, gastric discomfort, he has a palpitation. Even with the salivation, he has a palpitation. Even with the liver and spleen complaint, he has a palpitation. So whenever you find this type of personality, you can think of Calcarea ars. So the key point of Calcarea ars is desire for the warm food and warm syrup along with the concomitant symptoms of the palpitations and the midnight aggravations. Another remedy you all have learned that is the Calcarea florata. Calcarea flor can be hot, can be chilly, and Calcarea floor is the most selfish, like pulsatilla and the money-minded remedy. So those remedy who goes into money-mindedness are the selfish remedy. The same way the pulsatilla and the Calcarea floor are the selfish and the money-minded remedy. In Boric mind symptom, it was written only one symptom has been written that fear of financial ruin or groundless fear of financial ruin. That means he is constantly in the worry of or anxious about the money matters and he is the money minded remedy. So this is the Calcarea with less attachment to the home, family, and the parent. Why less attachment? Because the Calcarea floor having a floor component and floor is the outsider and floor is more what we call as attached with the outsider business, money, luxury, and everything. Whereas Calcarea want the safety security of the home, whereas Calcarea floor wants the safety security of the money, luxury, and the things which he is relished with, like a veratrum alp. So he can be exclusive also, Calcarea florata. So the world revolved around is the money, luxury, car befitting the fluoride element. So this is what the Calcarea floor is. The less attachment with the home, family, and the parents, the facial features. So, as you all know, those who are more money minded, and the business peoples. The facial features are the squarish type, less fleshy, with the exostosis and prominent bones. Shows the hardness, induration, exostosis, tumor when psychosis is predominant. So here, this is what you have to keep in mind that all calcarea are fat, flabby, and soft, whereas the calcarea floor is very hard and indurated type of personality. So whenever you shake the hand of calcarea floor, the hand is rough and the hard. Show curvatures, fissulas, caries, and cancers when the syphilis prevails. So this is what the psychosyphilitic remedy in calcarea. So contrary to the other calcarea, the brain is sharp, comprehension is easy, concentration is active, especially when doing business and accumulating money. So Calcarea floor goes into gambling, Calcarea floor goes into a stock market and making money. So where this comprehension is easy, this concentration is very active and doing business and accumulating money. The insecurity of Calcarea, the fear of into want, and the poverty makes them go into business too early in their age. They rarely pass their graduations because the mind is too weak to concentrate on study. Their mind concentrate on the things only one thing, how to make a money. So this is what Calcarea floor is. In spite of having a big successful man, you find that there is weakness in the study also. So in childhood, they have a difficulty in reading, difficulty in study, but as they grow up, they can use their brains for the business as well. And this is because of selfishness. The brain can be used well only for selfish gain. They crave sweet but hate rich foods. Insecurity at the genetic level always makes them go in an accumulating mode. So this is seen in all cells and tissue as well. The slightest injury to skin, bones, and any internal tissue will causes their defense to thicken, indurate, or deposit fibrin for extra safety. This gives rise to the callosities or a bones on the skin, exostosis and calcanean spur in the bone, fibroids in the uterus, and keloids at the operated locations. This shows overcautious defense of the calcarea floor due to insecurity about the futures. So in calcarea floor, we have seen that the money-minded, the luxury, the hardness, the indurations, and the selfishness are there in the calcarea floor. The calcarea mule, the another remedy of the calcarea group, as we all know, this is less proven remedy, but the indications of this remedy is most important. It is also the combinations of the calcarea with the natrum mure theme or a muriaticum theme. And when you apply this knowledge, it is one of the best remedy which I personally use in cases of PCOD, and in PCOD I got wonderful results. Many a time you have prescribed the natramune to the patients and your patient would not improve in case of PCOD. You go with calcarean mule, you will get the wonderful results. So this is what my personal experience in many cases where I desperately failed with the natramune, and then I found that calcarean mule works wonders. And another remedy which I generally use in these PCOD cases is Baraita-Mure also. So whenever Natrum-Mure kind of personality and you find that it cannot help you, then you can think of another two remedy, that is Calcarea-Mure and the Baraita-Mure. This is not well proven remedy. Description of this remedy has been frequently influenced by Jan Scholten's The Theme of Muriaticum having an attachment to the mother. So prescriptions of the Calcarea mure have been given wonderful result, of course, on hypothetical pictures of combining Calcarea quality with the muriaticum quality. So as you all know, that gives rise to a trait of being timid, anxious, anticipations, and desiring support of someone. The muriaticum gives rise to the trait of being warm, though chilly cannot ruled out. So Calcarea mure can be chilly, can be hot, can be thirsty, can be thirstless. very reserved, introverted, and seeking support of the mother. So this is very important you are thinking. So the motherly attachment is there. This mother support could be slightly modified to anyone who gives nourishment, and hence it could be a father who gives motherly love too. So in short, Calcarea mure is a Calcarea which is hot or chilly, reserved, introverted, and needing mother support. As I have read Calcarea Mure from the Essence of Pediatric by Dr. Praveen Jain, in which he has written that Calcarea Mure, although very, very insecure, they become so much so mature and take the responsibility of the family. And that is why sometimes this is overburden of responsibility with the insecurity gives rise to a PCOD, and that is what the Calcarea mule is. So I had few cases which will not yield to the Netram mule and other remedy yield in the Calcarea mule in a PCOD. Calcarea sulf, as you all know, the sulf element attached to, and that sulf attachment gives rise to the ego. So the Calcarea, which is very, very egoistic, angry, quarrelsome, with the only courageous Calcarea is Calcarea sulf. So here she loves to be appreciated, and the symptoms which we have that lamenting when not appreciated. So how the persons wanted to tell you like this, I have done so much for the family, but no one in the family seems to take notice of it. They always praise or appreciate my younger brothers, who is very happy-go-lucky and impress my parents with his sweet talks. This complaint is so common for Calcarea sulf because Calcarea sulf is one of the remedies that there is a sibling jealousy as well as wanting appreciation from everyone and always complain that he is not being appreciated. So the rubric is lamenting have not been appreciated. In the Indian joint family where the two daughter-in-law stays under one roof, one of them is angry, aggressive, loquacious, and perfectly manipulative and impresses the mother-in-law with her sweet nothing. Her elder sister-in-law, who is timid Calcarea, goes on serving the family timidly and feels that the family members neglect her, do not appreciate and what she is doing, and instead are partial to the younger daughter-in-law. Then she develops a jealousy and hatred toward that personality. This elder one would be Calcarea self if the thermal and thrust matches. So this is what very, very important the situations you will find in a common Indian family setup. Cheerful in day, sad in the evening. So whole day she is cheerful and suddenly at the sunset she becomes sad and depressed. She hates sunset. She thinks and laments so much that her people do not appreciate her and her reactions is anger. So very, very important that she wants appreciation at the end of the day. But if she didn't get appreciation, she goes into a sadness. The anger, this is an angry calcaria. The anger turns to the hatred as in the syphilis. So miasm syphilis start expressing. Interestingly, the sensitive point of calcarea self is that the soric sensitivity is surrounding the family. In Sora, they have attachment to the home, family, father, mother, and sibling, brother and sister are very important for them. Even though they might get hurt or pain from their own, they may develop hatred or anger, but there remains a love-hate relationship with them. Even when in syphilis they develop a hatred for the father or mother, their love for them will always be somewhere present, and an urge to go back will always be stronger than the urge to break off due to the hatred. So here, very, very important thing is whenever there is a hatred towards the family and the breaking of relationship, that is the plateau. But here the hatred is there, but still remain in the same home, and the feeling of the grudge and hatred is there in this. This is the Calcarea sort. They will not break off due to the hatred. Because Calcarea want the safety and security from the home, so that is the reason that they having the anger, but do not break off. Calcarea self, therefore, a person with a dilemma, he often is mistaken for the lycopodium or a platina or even a staphysaceae. The stiffness, obstinacy, and the timidity, like lycopodium, internally timid but externally very hard. The aversion and hatred of the people who disagree with him compares favorably with the cutting of relationship like that of the platina does. But here Calcarea does not sensitive to the horrible stories and not able to fight, though angry persons look so much like Stephysagria if thermal get confused. So of course Stephysagria will be chilly whereas Calcarea sulf is the hot remedy. Even though angry due to timidity, he cannot fight and suppresses his anger. You can think of the chili, Stephysagria, hot, Calcarea, sulf. Stephysagria does not fight because it is sensitive to what people may say about him or his behavior. His dignity comes in a way, whereas Calcarea self wants to fight, quarrel, but cannot because of his timidity. His timidity and cowardice comes in the way. So this is what very important you have to keep in mind along with the thermal so that you may not miss with this remedy. So anger of Calcarea self is expressed in a two-way. In the beginning, his suppressed anger leads to no answer reactions. He is aversion to answering of the questions which visibly irritates him. But if he flares up, there is a lot of arrogance that can put a veratrum alb or a platina or a lycopodium to the shame. So anger of Calcarea self is peculiar. After anger, there has to be a tremendous weakness and the tiredness. So this is what very important that Calcarea self is. This anger comes only when his image or a status is threatened. So Calcarea self has a sensitivity to the social position and his image and his status. So whenever the anger comes because his image or status has been threatened. My belonging and the product that I sell or make are exclusive and a class apart, and I cannot bear anyone calling name or even criticizing it. Buy it or leave it. I don't need you. Those who know my quality will come, appreciate and buy it, but no compromise. This sounds like a platinum, but the softness and the attachment to the family will always betray the criteria with me. So this is what very important. It is again same like the platina, but you have to keep in mind that it might be a healthy. The attachment and anxiety for the family is as a rule for a support required by him from the family without which any Calcarea cannot survive. So all Calcarea wants the family. There are some other constitutions that are also family oriented, but they love to give support to the family rather than take support from it. Is it like a Calcarea? Again, the Calcarea self is one of the delicate remedies. This constitution can never play a sports. This is was our clinical experience. That Calcarea self is very, very delicate and can never play a sports. So Tuja has a constant fear of getting hurt and therefore does not play dangerous sports or the game and become cautious. The reason here is different. The cannot Calcarea self cannot bear exertions of the any kind. So this is what we have so mental exertion, all calcaria is affected by the mental exertions, whereas calcarea self cannot bear any kind of exertion, either a mental or the physical. This especially in the psychosis, the fat children who get breathless easily on ascending stair or on running, cycling or playing sports may well be calcarea self. So this is what very important. So this is observation. So fat children who get breathlessness easily on ascending chair or while playing. Children or adults who are restless, wants to wander, but do not like to walk are the commons in today's life. These are the Calcarea kind of personality. Modernizations, money in the plenty with the luxury of all kinds has made people lazy and delicate. Calcarea self symbolizes the exclusivity, money collections for security, and ultimate laziness. So combinations of laziness plus exclusiveness plus money minded is the Calcarea self. The modern day obese wants to reduce weight and decide to take a morning walk in a nearby park. But when they reach the park, Then they try and search for the first possible chance to sit, and then the desire to walk is gone. So this is what the laziness is of a Calcarea self. Cockroaches in psychosis, the calcareas are most sexual desire, and the urge are also prominent in calcarea self. The sulfur friendliness, when added to the calcarea's attractions for opposite sex, makes them very friendly with the opposite sex. A wife of calcarea self will always complain that her husband has at least one new extramarital affair every 3 years. This is what the coquettishness is. He is easily attracted to and become a friendly with a colleague or assistant in his office or the clinic. But these affairs may not be serious as Calcarea self is a coward. So this is very important. Confusions. So forget, as we all know, the confusion is always there in all Calcarea. So confusion is a hallmark of all Calcarea. The forgetfulness and the weak memory. In syphilis, the calcarea self-constitution tend to forget. The weakness of calcarea brain is always exhibited when it is under strain. All calcarea, along with the calcarea self, have a weak brains. Weakness in the brain is more pronounced when there is a strain on it. So, overexertion, overstudy, mental exertions can lead to the weakness and confusion. But calcarea self brain has sudden and periodical weakness in the memory. A person forgets certain things for a time being, but regains his memory after a while. This loss of memory and confusion can occur on occasions like after eating, hearing bad news from anticipations, that is during exams or interview, and overexertion of the mind. So these are the possible things. After that, they can again remember. So whenever they go to interview or an exam, during exam you forget the things, and after finishing the exam you remember, oh, I write this. So this can be a criteria self. The last three are the common for all calcarea, but the eating after aggravation is the hallmark of calcarea self. So forgetful, memory weakness after eating. This is the calcarea self. But otherwise, all four are there in the all calcarea. So calcarea self having the forgetfulness, the delicateness, the awkwardness, and angry and hatred kind of personality you can think of is the calcarea self. Some generals and the physical that can act as an entry point in calcarea self. So the commonest aggravating point is eating after is the commonest aggravating factor of calcarea self. So after eating, there is a loss of memory. While eating or after eating, there is a flushes of heat, and after eating, there can be headache too. So this is what calcareous sulf is. Again, sulfur. So bathing is one of the indications that bathing aggravates easy tiring and does not work because of laziness, the easy brain fag because of overexertions, the weakness after the anger, there is a trembling after anger, the staphysagaria, weakness after anger, the calcarea sulf. Even there is one rubric is trembling, anger suppressed from there is the aurum and staphysagaria. The yellow discharge and yellow pus from the boil on the skin. So whenever you find any personality with the suppurative tendency with the yellow discharge and boil and recurrent tendency to develop a pus, this is calcarea sulf. Crusty scaly eruptions like a psoriatic type of eruptions, the nausea aggravated in the warm room like pulsatilla, opening everyday like pulsatilla, and proof only on waking in the children. So सुबह जब उठता है तो एक अलग तरह की खांसी आती है, that is what the proof, and especially in the children, proof only on waking in the children. They are the calcarea sulf. So resume of calcarea sulf. Egoistic calcarea complaint is not appreciated. He is not appreciated in the Sora, aversion to people who do not agree in psychosis, aversion to answers in psychosis, and hatred of the person who do not agree. This is the syphilis. They are hot, thirsty, timid, quarrelsome, angry, calcarea, very delicate people who hate walking and hate sports, very important, and egoistic and cockroach type of personality. So whenever any persons come to you and they say that I need to lose a weight, and you advise that you need to walk for a 3-4 kilometers a day, and he plainly says, sir, I can't, I can go to walk, but I can sit there and rest there. So this is what something that Calcarea personality is, Calcarea self laziness. Now, how Calcarea self patient comes to children comes to you in your clinic. So the Calcarea self children are very sensitive children, very timid children, children who wants mother and family support, children who do not like to study, especially mathematics. They are Calcarea self. Children who, when forced to study, undergo mental strain and the brain fag. Children who answer everything at home but forget everything when they start writing their exam paper or during exam they go blank. So this is very important indication for Calcarea self. Children who are afraid of the parents, afraid of being scolded and punished. Children who are jealous of their brothers and sisters, so sibling jealousy. Children who feels what they do not being appreciated by their parents, yet they are attached to them. Children who fears birds, feathers, cotton fibers, animals, lizards, snakes, etc. Because all Calcaria having a lot of fear of animals and everything. Even a rat, fire, and murder. This is the indications of Calcarea. Yes, Calcarea floor is more mathematics because they are business minded. Even exertion of the mind can lead to a confusion, but Calcarea floor is selfish and money minded. That's why the mathematics is good in Calcarea floor. Due to the floor, he take the risk, but Calcarea does not. So this is what Calcarea floor is more money minded, and that's why they goes into collecting money, and that's why they have a little more mathematics apt for. Whereas in all Calcarea, the mathematics is weak. Children who are afraid of being injured in a sport or afraid of being tired and hence do not take part in the active sport. So many a time you are taking the history and you ask children or any person that do you have any extracurricular activity in your school life? And Calcarea self children says that they do not go into sports. Okay, because of being injured or because they are tired and they do not take active part in the play. Children who do not spend money but save for their futures, they are Calcarea self. Children who cannot bear cruelty to the animals or cruel scenes in the movie, this is Calcarea self. Even all Calcarea has this sensitivity. The children, despite being timid, are obstinate and headstrong. Children who giggle a lot, children who are bitterly sad about the treatment given to them by their parents who feels they receive stepmotherly treatment. So this is what very important. This is the anger towards the affections. And that's why they develop the hatred. So these are the Calcarea self personalities. Now the another Calcarea is Calcarea iode. Yes, both palladium and calcarea sulfur both want appreciation. See, simple understanding of palladium is the remedy for the wanting for the good opinion of the others. So they always want the good opinion of the others. I will show you one video, and that's what the palladium is in this session at the end, so that you will get that how the palladium is. Whereas Calcarea self becomes so much so angry when they do not, and they want appreciation of their work. So most of time in a Indian family setup, they feel that I have done everything for this, but they do not understand and they neglect me, and they do not appreciate what I have done all for that. And that is what the Calcarea self. But Palladium for their own look, Palladian for their what we called as their concerns, they always go to somewhere in the party. Palladiums are the party peoples, they are the social people, and they love appreciations of their aesthetic looks, their concerns. Whereas Calcarea self want appreciation of their work they have to done. So this is what something different, some little difference you have to think in. I will show you one video of Palladium, so it will give you an idea. Both require appreciation, and always the Palladium wants good opinion of other. If you say bad opinion, they do not love it. They want always a good thing. And again, the Palladium is not so angry kind of personality. They are a good, charming personality like a phosphorus. So back to our Calcarea, we'll share the video in at the end of session so that you will get idea. Calcarea audita, the one of the hottest Calcarea in our Materia Medica. Calcarea audita, hot Calcarea with the glandular affections, as iodum has the affinity towards the glands. Glandular Calcarea, mostly psychosyphilitic. This is an impatient, restless Calcarea. All Calcarea are slow, sluggish, and tired, whereas Calcarea iode is impatient and restless. This is a hot Calcarea with intolerance to cold wine. This is the Calcarea which has an oval shaped face because iodum have a oval shape and constitutions, sensitive constitutions with the sharper features and is thin because of iodine ailment. So all Calcarea is fatty, whereas Calcarea iode is thin. This is the Calcarea with a glandular enlargement or glandular involvement with the emaciations. This Calcarea who is mentally restless but physically weak and require alcohol or a stimulus to pep it up. So this is what we call as addicted Calcarea with alcohol and stimulus is Calcarea iode. Some important entry points, the people who are hot and desire for open it but sensitive to wine draft, they get headache from the riding or motorcycles when they are exposed to cold draft. Female who suffer from the thyroid problem during puberty, menses, pregnancy, goiter associated with the female hormonal imbalance, the Calcarea iode is one of the indications. The young boy and girl who wear most trendy clothes, the psychotic myasthenia is seen in young children who love to young boy and girls who wear most trendy clothes. The psychotic miasm is seen in young boy who love to wear a trendy clothes or a modern clothes, and they are very careful about how they present themselves. They love perfumes. When they return from school, the restlessness prevents them from sitting at home and compel them to go in the open air. So this is what Calcarea iode is. And move on bicycles, motorbikes, etc. They love cold air, cold winds on the face, which aggravate them and cause headache. Occupations aggravate officers or the mental workers who complain that their work is hampered because they need to go for urinations very frequently, especially when they are occupied. The urine they pass is very little but frequent. So this is what very important understand. Again, it is the symptoms of diabetes, and diabetes is because of the gland affections of the pancreas. So Calcarea iode, you can think in diabetes also. People who are changeable like pulsatilla symptoms, they are changeable. Like pulsatilla, the anxiety comes and goes in paroxysm. Like pulsatilla, desire open air, but worse in the cold draft. Like pulsatilla, very irresolute, as all Calcarea are irresolute, but not thirstless like pulsatilla. But they have thirst especially for the stimulant like the Coke, Pepsi, orange, and alcohol, etc. Pulsatilla loves consolations and Calcarea loves support. So this is what the little difference between the Pulsatilla and Calcarea iode. Another hard calcarea which is given in this book is the marble. So marble and granites are both comparatively newly proved medicines and have not been used much by many. The prolifics are more reliable than the newly proved remedies, is the statement made in this book in the introduction. But these two have been an exception to this rule, more because they are not from the completely new origin, but are extensions of the calcarea carb and silica of our great polycrest. These two have strengthened our armament and have complemented the Calcarea group. That's why it is taken as extensions of the Calcarea. So marble and lap marcy, this is a marble, is an extended Calcarea. So marble itself in India is associated with the rich and the famous. So we have prescribed this for the patient who dream, imagine or behave as they are rich, famous or a noble. So this is what very important understanding that the marble is a symbol of the richness, famousness. The same way the person who dreams, imagines or behave as if they are rich, famous or the noble. So the example, the 14 years old boy was cured with the huge left-sided hydrocele with the marble. Interestingly, his father was cured of his lichen planus and diabetes with the platina, and the maternal grandmother cured of the pulmonary clots with the calcarea fox. His mother's varicose eczema was cured by the natrum mule. So this was the family. This boy had taken the parental side trait as dominant characteristic, was a perfect blend of his father's haughtiness with the grandmother's timidity. He was lean, thin, tall, with a long neck, with fair, delicate skin of the grandmother and attitude of the father. This child was born timid, fearful, weak, but dreams of becoming rich and famous. He always dreams as imagine in the wakeful hours that he is a princely figure or a Maharaja. He would imagine that he is relaxing in a royal chair and he has many servants to press his feet and hands and body and he loves it. He liked the game of the cricket, but he never liked to run or field the ball. He would imagine that he is hitting the ball with a bat and his friend would run after the ball to get it for him. And this side he would enjoy. He felt he was neglected by his friends who scorned at his laziness. He always dreamed of taking revenge on them when he grew up to be a noble man. He was chilly and dustless and loved a luxurious life like that of a Maharaja. So the haughtiness, self-esteem, egotism, delusions, great he is, delusion, distinguished he is, delusion, noble person he is, and in the core he is a cowardice. So marble is predominantly a psychotic remedy as luxury, slowness, and egotism indicate. It loves vanity, it loves to be cared for like a calcarea. So they want flattery desire for and pleasure seeking. It like to be caressed, it love to be pampered. This is exactly opposite of the granite. So granite is syphilitic. So we have psychotic, more psychotic is marble and psychosyphilitic is the granite or syphilitic is granite. So here the few indication of granite is syphilitic and suffer from the slow moving destructive disease like the autoimmune disease. For example, RA, Hashimoto's, slow cancerous tumors, and the retinal detachment. The speed can never be fast enough to cause the leukemia, pneumonia, meningitis, etc. The granite never loves vanity and shows. It likes to be crude without any vanity. It has no scope for love, affections, and caresses. So, lack of love, caress, and affections are there in granite. It is independent and hates help and company, unlike marble. So, granite does not like company and hates it. So, this is the few indications of the marble and granite. So, the vital differentiating point of this is Calcarea is this. So we have the Calcarea group. Calcarea is timid, anxious, and insecure. Whereas Calcarea ars, Calcarea pos are the chili, Calcarea mure and flor can be chilly and hot, Calcarea sulf and Calcarea iode are the hot. The fastidious, anxious, Calcarea with a gastric complaint and palpitation, Calcarea ars. The active, restless, travel, wonder, desires, Calcarea are Calcarea pos. Mother attached, introverted Calcarea are Calcarea mure. Money-minded Calcarea and selfish is Calcarea flor. Egoistic, angry, quarrelsome is Calcarea self. And depressed, sad, impatient Calcarea is Calcarea iode. So above is the chart of the shortcut to the Calcarea salt. Once a Calcarea trait is recognized in the patient, and the above chart can be used to differentiate between the Calcarea calf, Calcarea post, floor, sulf, and iode on the basis of this thermal thrust and mental disposition. Now you have to understand that Calcarea ars loves warm soup, Calcarea post loves travel and wandering, Calcarea food cling to mother, floor cling to money, self cling to ego, and I would cling to God. So this is what you have to understand in nutshell about the Calcarea. And when to rule out Calcarea. These are the few points you have to keep in mind that you have to rule out Calcarea when these symptoms are there. So when to rule out Calcarea. When the person is independent and does not require any supports, then you have to rule out Calcarea. When person is not close to his family, mother and father, it is Calcarea. Except Calcarea floor, Calcarea floor can go away from the family's parents and everything. When a person is fast, hasty, or quick in except so when to rule out when the person is fast, hasty, and quick in excess, you have to rule out the Calcarea, except you need to take into consideration of Calcarea pos and Calcarea iode because they are fast. When the disease is moving fast, rapid in progressions and rapid in destruction, you can rule out Calcarea because all Calcarea are slow. So the disease also slow. The genetically they are programmed to be a slow. When a person is not money minded, despite having less of it, a Calcarea can have no interest in money when he has ample of it and contented when he is clinging to God and religion for the support. So this is what very important. Calcarea shift their support from money to the God when he has ample of money. Okay. So but when the person having not money minded despite having less of it, then you have to rule out the Calcarea. When a person donates generously to the institution and does not want his name to be declared, neither he wants anything in return, then you have to rule out the Calcarea because Calcarea wants his name to be written on the golden plate. When a person is not very careful about his health, rule out the Calcarea because they are very anticipatory, anxiety, and anxious about their health. The persons who is rash and negligent and not very cautious, you can rule out the Calcarea. The persons like hot foods and hot drink except Calcarea are that require warm soup and warm drink, you can rule out the Calcarea. When the persons does not have anticipation, rule out Calcarea. What may not rule out Calcarea? So the Calcarea can have no interest in money when he has ample of it and is contented when he is clinging to the God and religious for the support. So this is what very important understanding. A person who is not close to the family but is close to the friend or a religious organization or a cult because he gets more support from this than the family can still be a Calcarea is. In psychosis and syphilis, the anxiety, anticipations, and the fear are hidden under the psychosyphilitic trend, and hence the persons may appear confident without anxiety and anticipation. For example, cautiousness and carefulness develop in psychosis to compensate for the anxiety and anticipation. Thus, the psychotic Calcarea will prepare for an event anticipating the worst week before the event, and hence it is not nervous with the approaching event. So this is what psychosyphilitic Calcarea is. A Calcarea calf, though predominantly right-sided, can be left-sided as well. So this cannot rule out the Calcarea. Few remedy comparisons with this Calcarea is Kali and Calcarea and Pulsatilla. So Anxiety of the Kali and Calcarea, the anxiety as in case of the Kali, a Kalika lady is so anxious that she literally throw herself on the physician. The physician literally go in a defensive mode when Kali is complaining. Why does this happen to me? Why don't you give me some good medicine so that I get cured faster? Why have your medicine not worked on me until now? How come others get quick relief with your treatment and why not me? This is the way Kali anxiety attack forcing the physician to find an escape route, manipulate or devise a satisfactory answers. It borders almost on quarrelsome, not so with the Calcarea. The anxiety, though, is passive, they don't hurt and don't like to be hurt, so is defensively anxious persons can be Calcarea. The physician is not taxed to give answer. He is relaxed and can think. He does not have to waste his energy and time to give answer to fruitless questions. The female Calcarea wants the physician's shell to protect himself. He gains in confidence as the physician shows confidence in treating him. He knows he is in a safe hand. So this is what the difference between the Calcarea and the Kali. So Kali is always quarreling with the physician. In spite of that quarreling, they never leave the physician. This is also a Kali. Whereas Calcarea does not leave the physicians because Calcarea wants the protection from the physicians because he feels that he is in the safe hand. The third anxious remedy constitutions is the pulsatilla. The pulsatilla has an anxiety which lies between the Calcarea and the Kali. It is neither aggressive like the Kali nor quiet and not and or receiving end at Calcarea. They are weeping. Pulsatilla will show its helplessness and urge the physician to give her relief. Doctor, please help me. Will I be okay or not? Are the questions of the pulsatilla patient asked against the Kalika. Why don't you help me? Why am I not getting better? In short, pulsatilla does not question the physician's ability, but plead for the consolations. So this is what very difference when the person is asking you. So the tone of persons can suggest that this personality is Kali, this personality is pulsatilla. The consolatory remarks by the physicians, okay, you will be fine by tomorrow or the next week, is that the eager pulsatilla ears are waiting for. The Paraita are devoid of anxieties. If at all they are anxious, the anxiety is completely misplaced. As described in the chapter of Paraita, we have seen the China. China is anxiety of the different type. It is complained that he or she is being harassed by many things around. There is no aggression like Kali as to why this and why that, but there is a distinct sadness on the face, which is a reverse frowning, indicating what to do, why me, and why me only. So this is what China goes into unfortunate personality. So to conclude this, today we have concluded the Calcarea group, and we will continue Kali group from tomorrow. And I will show you a video of Palladium as a rubric to understand the rubric from the video. So I will show you how Palladium present to you. I am sharing, let me share with you that video so that you will get some idea how the personality want appreciation from you. Look at this video and you will find that one lady coming down coming to the going to the party and she's asking for something to the husband and how the husband reacting.
Okay, I'm ready. How do I
Fine, now let's go.
look? Fine, I need gorgeous. I'm changing.
I meant good. Why didn't I say gorgeous? Why?
Okay, I'm ready. How do I look?
Fine, now let's go.
Fine, I need gorgeous. I'm changing.
I meant good. Why didn't I say gorgeous? Why?
So Did you got it? Video is not visible. Okay, we'll share again. Okay, okay. Now screen is visible. Now visible. You had seen, na? So this is what the Palladium personality is. There is no aggressions in them, and they want the concerns about their looks, and that they want the good opinion from everyone, and that is what their appreciation desire for is. Whereas Calcarea self appreciation that I have done so many things for my family, and my family does not know. There is no video. You had seen video or not? I have shared it. Shared it. Okay, 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 okay. Let's have another. We'll share the screen and then you can see that. Okay, now you can see the screen. Now the screen is visible or not?
Okay, I'm ready. How do I look?
Fine, now let's go.
Fine, I need gorgeous. I'm changing.
I meant good. Why didn't I say gorgeous? Why? Why?
Okay, I'm ready. How do I look?
Fine, now let's go.
Fine, I need gorgeous. I'm changing.
I meant good. Why didn't I say gorgeous? Why? Why?
Okay, I'm ready. How
Now
do I
video
look?
is visible or not?
Fine, now let's go.
Fine, I need gorgeous. I'm changing.
I meant good. Why didn't I say gorgeous? Why? Why?
Yes. Now you have seen that how the personality is wanting the appreciation from everyone's, and the reaction is also like this. So they want a good opinion of others, and most of time the persons who love to dress love to dress the best things, and having they wanted appreciations of that things from others, and that is what the Palladium is. So Palladium wants appreciation for his look and his concern, whereas Calcarea self want his appreciation from his works. This is what I personally understood in many of my cases, and I prescribe on the basis of that. So hope you all understood it in a better way, and we conclude the day today. So thank you so much. Thank you all. We'll continue our journey of Materia Medica of Kali group from today tomorrow. So thank you. We conclude the day today. Thank you so much.